Well, hello there. It's so great to be back this week. I have to tell you, I have such a special guest. And I have to tell you that this is probably the first time I've had an in-house podcast with a very special guest. So I'm going to introduce to you Dr. Deanna Pallin. And she is an incredible obesity medicine physician. She owns New Start Medical Practice, and she is one of the few obesity medicine practices that practices all four pillars of obesity medicine. So let me tell you what that means. So she incorporates mindset work. She incorporates nutrition management. She incorporates exercise programming, particularly strength training, along with medication if it's indicated to help patients achieve their most optimal health. And so I brought her in here today because she has taught me so much. She is a wealth of knowledge. And honestly, she is going to be the perfect person to answer all your questions. We are going to be doing a series, a 3-part series. And in this episode, we're talking about who should go see an obesity medicine doctor and what to expect with that first visit. Welcome to the show.
Thank you for having me.
I'm so happy you're here.
I'm so excited. I am in this gorgeous setup. That's amazing. So, what was the question?
I introduced you, and I just want to know, or actually I want you to tell everyone, your practice of obesity medicine has been decades now. I mean, you were really, really there right in the beginning. Can you talk a little bit about what it was like when you were one of very few practicing obesity medicine?
So we opened in 2015. So that is 10 years this year. We have that celebration. And we started with 15 patients, right? It was me and a receptionist. And we have grown now to over, I believe, 3,000 patients.
Wow.
Yes.
I love it. So what is it like now that this is the first decade in our country's history that we're actually seeing a decline in obesity? What's that like to have been practicing this the entire time and now it's the first time we're actually seeing a bit of a decline?
It's a really exciting time because we have so many tools, even though some are more expensive than others, but we have way more tools than we ever had before. And I think that is a result of why the obesity rate is declining. And it's exciting to put in the hard work and to actually see the numbers go down. Yeah. And it just kind of puts wind in your sails, right? As an obesity specialist. So this is an exciting time for us obesity specialists.
I love it so much. I totally agree with you. I think it is absolutely the best place to be. All right. So what everybody wants to know. Okay, I get these questions all the time. I think a lot of the reason why people are asking the questions now is that a while back, it was shameful to think about needing an obesity medicine specialist, right? Shameful to think about needing a medication. And now, we have a lot of people who the medication is really helping. So can you talk just a little bit about who should come see an obesity medicine specialist?
Yes. So anybody that has unhealthy weight. What do I mean by that? Unhealthy weight doesn't go by BMI. Unhealthy weight is basically a weight that is associated with either metabolic diseases or it causes a physical restriction on the person or it impacts your body image, your mental health, whatever the aspect would be. So I don't guide my treatment of somebody by their BMI or by their weight, by that matter, right? So in 10 years, I haven't denied care to anybody. They didn't follow my program because of their own choice, but not because I didn't accept them in my program. So as long as you're not going through an acute illness, which you need to recover from, you can start one of our programs, which are designed really to treat you, to help you get to metabolically healthy you, right? Not to a certain number on the scale. It's good to have a goal, but we're looking for a healthy metabolism. So who should come see us? If you ever struggle to maintain a healthy weight, you should probably, contact us. If you have prediabetes or diabetes, or PCOS or fatty liver, and I can go on. It's over 200 diseases that are related to obesity, and they get better with lifestyle changes. You should come see an obesity medicine specialist. If you are on an obesity medicine already and you're not getting the results that you want, that means you might be missing the other 3 pillars that are required.
I love that explanation, and I want to highlight something you said because it was gold. You said that you don't treat a weight, and what you treat and what obesity medicine treats is the presence of metabolic disease.
Exactly.
I got chills because here's the deal. It honestly doesn't matter what you weigh. Yeah. If you have metabolic disease, like you might not be in a BMI range right now that is considered, and that's all going to change. It's going to change with how they prescribe medication or how they allow medication to be approved with BMI. But with that being said, it's not about that weight. It's about, do you have metabolic disease? So I love how you mentioned PCOS, fatty liver. You said there's over 200 diseases that are correlated really with having a weight that predisposes metabolic disease.
Yeah. Yeah. I mean, you can have a normal BMI, and there's a term for that. It's called TOFI, thin on the outside, fat in the inside. Yeah. So you do an in-body or a body composition analysis, and the body fat percentage is in obesity range.
Yes.
But the BMI is normal.
Yes.
So I think, you're missing a lot of people if you go by BMI.
Okay, that's another gold. This episode is gold. I need to repeat that. Okay. So what Dr. Pallin is saying is that you could be a normal BMI, even appear thin, and you could actually have obesity based on your body fat percentage, okay, and what it's doing to your metabolic health.
Absolutely, yeah.
Oh, man, I'm like, every time I talk to this woman, literally, my mind is like, whoa. Okay, because I know that, and I mean, we obviously, we're very similar in how we do things. We always joke because we always say we do things slightly different, but we do it for the same reason, and like we arrive at the same answer.
Exactly. And it's so much fun. Just come from totally different perspectives and arrive at the same results.
It's amazing, and I've really learned so much from you, and I'm so grateful. And
same here.
Yeah, truly.
I learned so much from you.
It's amazing. And so I love how we can absolutely talk the talk about BMI and, how we use InBody. Yeah. So let's just talk a little bit about somebody coming to you. So we kind of already set the stage. So, anybody who is at a weight that is causing some kind of metabolic disease, if you've struggled to maintain a weight, right, that will keep you healthier, any of those things, even though you may have a normal BMI, yes, absolutely. An obesity medicine specialist is somebody you're going to want to see. Okay, so tell me, because we're going to go into like what to expect at the first visit, okay? Tell me some of the things that patients who didn't even think to come to an obesity medicine specialist say to you when they arrive and realize that you're exactly who they were looking for. And I'll say it a different way. So, as you mentioned, somebody who may not be in the obesity range for BMI, but yet something's off to them, right? And they are starting to see elevated hemoglobin A1C, and then they meet you. What do they say when they realize, wow, this is exactly where I need to be?
Well, they tell me that finally I'm talking to somebody that gives me an answer for why I feel the way I feel.
Yeah, yeah.
And there's now an explanation, and it's not all in my mind.
Yes, yes.
So I think that is the most powerful feedback that I get. And then another feedback that I get a lot is like, wow, this is a very comprehensive approach. I was just sent here for the medicine because my PCP couldn't get them approved.
Yes, yes.
And wow, like we're doing all these other things that I had no idea.
Yeah.
And then there's the patients that actually know about my practice. And I went ahead and I did my TED Talk for this purpose because people don't know what obesity medicine is. So I have patients that come in because they saw my TED Talk.
Yes.
And they are the ones that know what to expect.
Yes.
And they still feel empowered and motivated, but they're ready for all the tools because they knew what to expect. I also send out a one-pager, what to expect at the first visit in the welcoming email. And I recorded a 5-minute video that's on our app that kind of, tells them about what to expect at the visit. So there's I think it's all about expectations. And typically, if they're there just for the med, they're going to be disappointed.
Say that again. That's so important. Say that again.
So if you come to see an obesity medicine specialist just for an obesity medicine or an anti-obesity medicine, you're going to be disappointed because we do not prescribe medication without the right nutrition plan, without behavior modification, without strength training and the right composition and monitoring your body composition and seeing us every 2 to 3 weeks. That is an intensive lifestyle modification. It takes that frequency to call it intensive. So if you're there for the med, you're going to be disappointed.
Totally. I love this because how many times, because we run things a little bit differently, obviously. You're a full-on obesity medicine practice. By the way, we're going to link all of New Start Medical in the show notes, but New Start Medical is located in Doylestown, Pennsylvania. So it's outside of Philadelphia. So if you are somebody who lives in the state of Pennsylvania or can get to the state of Pennsylvania and you are looking for literally like the best obesity medicine specialist, like we're going to link New Start Medical. So comprehensive, so amazing. But the really cool thing is that while Dr. Pallin, you have the whole thing, you do, all 4 pillars, because I operate in more of a coaching realm, clients are coming to me, and I call it clients because I'm not their prescriber, are coming to me on a medication, and then I'm helping with the nutrition, the exercise, the mindset. Okay, so it's really cool because I'm doing it, but I'm not the one giving the med, but I'm doing it with the med in some cases. Can you talk? Actually, I'm getting too excited. I'm moving ahead. For you in particular, in your practice, what can they expect on the first visit? What's going to happen?
Yeah, so on the first visit, they're going to have a comprehensive physical exam. They're going to have comprehensive set of labs that are going to screen for metabolic barriers.
Okay.
They're going to have a comprehensive interview with an obesity-trained provider to identify the numerous barriers and at the same time give them the tool to offset them. And our goal is for them to leave empowered and hopeful and more prepared for what they have to do and really believe. And I tell them every time they leave my office, I 100% believe that you can lose weight on my program. There's no doubt. The question is, how are you going to follow my program and what are going to be the barriers that stand in the way? And that's where we come in to help you offset those barriers.
Yeah, I love that. And you recently have instituted some groups within your practice. Can you talk a little bit about that? Because that's something that obviously I run groups. I see the power. Now, here's the thing. That's even bringing your practice to a whole new level because there's not that many practices that then run groups within their practice. Tell me a little bit about how that has helped.
Yeah. So the way we run the groups, we call them shared medical appointments.
Shared medical appointments.
So that means that and I'm the only one that runs them.
Okay.
It's about 6 to 7 patients. They have 5 minutes with me, individual, like a brief visit. And then we all go into our conference room and we have 45 minutes of group discussion. And there's a lot of interaction between the members. It's just as much as educational as support. And every time we've had a group, everyone walks out of there more hopeful. I walked out of there more connected to my patients. And if I feel more connected to them, that means they feel more connected to me. And it's a powerful intervention. However, I would say it's not yet fully utilized because people still have some barriers about sharing this very personal journey.
Yeah.
But the ones that have chose to do it are lifers.
Yes.
Like they even say like, look, I was like skeptical about this, but they're like, like I'm gonna come until you shut this place down.
Yeah, because the reality is most humans want deeper connection, and the way to get deeper connection is to be vulnerable.
Yes.
And that's the hard part.
That's the hard part. And that's what's holding people back. So I would love to have, you know, a lot more groups. I think there are not as many as I want because people have to be willing to be vulnerable.
Absolutely. Yeah. Oh, that's so good. So they come to see you, you do the exam, you're going to write for some labs. Now, do they get prescribed the medication right away?
If they had recent labs within like a month or 6 weeks, and some of them do, and they're ready to start the nutrition that we customize for them, and they understand the behavior modification that comes with that, and they're willing to follow our safety guidelines, we start the medication on day 1.
Yeah. Okay.
If they haven't had labs in 2 years,
right,
and they're not eating 3 times a day, we don't quite need an appetite suppressant when we need them to eat more. Actually.
Yes, right.
So very often there's the circumstance in which our patients are starving themselves, and we tell them you need to eat more.
Yeah.
So then a medication that suppresses appetite won't help. So then we do explain it, and you know, I would say 9 out of 10 they do understand, unless they're there just to get the med, which it doesn't matter what I say. If they're there to get the med, they're going to be disappointed. So I just came to accept that.
Absolutely. And I love what you said. That's really important. So if somebody is already under eating and they're not meeting their protein need, the last thing you're going to be doing is giving them, you know, an anti-obesity medication right off the get-go. I mean, right. So here's what's interesting about that, right? So we all hear in the media, those medications, they just cause muscle loss. And you know what's so interesting to me? There are like board certified physicians getting on social media and literally saying they cause muscle mass loss. And it is such a not true statement. So what you just said is one of the reasons why it's happening. Yeah. They come in, they're already not eating. They get the medication. And then they're not eating, but now their metabolic health is improving. Okay, so maybe their leptin resistance is improving. Maybe their insulin resistance is improving. So now they are losing, but they're already under eating, but under eating even more. And so are you kidding me? Of course you're going to lose muscle mass.
Yeah, and you're going to lose 50%.
Yeah, 50%. Yeah,
you're going to lose 50%. But it's not because of the med. No. It's because you haven't put the nutrition in its place. So my approach to this is that you get the results from the nutrition that matches your metabolism. You can implement the nutrition without the behavior modification.
Yes.
And then the meds, they're kind of like the cherry on top of everything. They help you optimize and get there. But the meds by themselves can only do so much, and they can harm too.
Absolutely. And I want to dive into that too, to just kind of talk about in this episode, just, you know, to wrap up just a little bit about, you know, who are they for, who are they not for? But the first thing I just wanted to say is, you know, and you've been involved in helping to coach both of these programs for me, but we have, you know, the GLP-1 weight loss program, and then we have the Transform program. So in the optimal GLP-1 weight loss program, they're on a medication. Okay, and typically they're coming to me because they want to optimize the medication. They haven't been counseled on nutrition. They haven't been counseled on exercise, and they're not doing mindset work. So they have the med, but they are kind of disappointed because it's not working, they say, or they're a non-responder. They're not a non-responder. You are not a non-responder, right? You have to do all 4 pillars for this to work, okay? So I see great results in that group because they're on the med, and then we instill the other principles. Now, here's the group where I really see massive results. It's my group that they do not come in on a GLP-1 agonist. Yeah. They do all of the mindset work. They do the emotional regulation work. They do the strength training. That becomes an absolute lifestyle thing. They do the nutrition. They are optimized on their nutrition. And I am helping them do as much as I can do for them to achieve fat loss. That's what they're trying to do with me. 6 months in, 12 months in, nothing. Then I say, okay, I'm sending you over to an obesity medicine specialist. Let's get some labs and let's see, do we need to add a medication? And can I tell you, that scenario, the results are insane. This is where I have people on agonists gaining muscle mass. Gaining muscle. And you see it. I mean, we look at the same in-bodies.
And that proves that it's not the medication that
Yeah.
causes the weight loss.
Yeah.
It's the nutrition.
Yeah.
Again, it's the nutrition.
Nutrition.
It all goes back to the nutrition.
Yeah.
I tell my patients on the first visit, if I would have a medicine that would help you lose weight no matter what, I will be on a sunny beach sipping a refreshing beverage and prescribing that medication for you. I would not be making videos and creating binders and customizing and working 40 hours in this practice.
Absolutely.
I mean, it would make no sense. Why would I do that?
Absolutely. Right.
There's not such a med. It all goes back to nutrition.
Yep.
And you need these other tools to implement that nutrition.
Absolutely.
And that's how you get that luxury car with all the bells and whistles.
Yeah.
Yeah.
It takes it all. You need it all.
And you got to be excited when you have something like that.
Yeah.
A lot of times I see disappointment because, I just wanted the quick thing. So just like we went from the extreme, like, I'm going to do all this on my own, no medication. Now we went to, I just want the med.
Yeah. Yeah.
Right?
Yeah.
So again, I see that part too.
Yeah. Absolutely.
And sometimes we, talk to the patient and they change their mind.
Yeah.
And I would say the most important thing when you come to an obesity medicine specialist is to keep an open mind and to be willing to do things differently than you have done them before.
Yeah.
And to have a really strong reason why you're going to do this, because otherwise it's not going to stick.
Yeah. Yeah.
So.
I think that's great advice. Okay. So we'll finish out today by just kind of answering, and again, everybody's welcome to come to an obesity medicine specialist, but the GLP-1 agonists aren't for everyone. So who would not be a candidate for one?
So if you have a history of chronic pancreatitis, should not go on. Won't have GLP-1 agonist. If you have severe heartburn, if you have severe constipation, if you have gastroparesis, or already your gastric emptying is, like you can have hiatal hernia with very restricted stomach. But, these are not the only meds.
Exactly. That's what I wanted to get at. Yeah. That's what I wanted to get at. Okay. So tell me a little bit more. So don't qualify for a GLP-1 agonist. What can you offer them if you do believe medication would be helpful with the other lifestyle parameters?
So I start with the reason why they're not successful. So I like to look at hunger from just two perspectives. I mean, there's a lot more complex than that, but I want to know if it's the physical hunger or the emotional hunger that I'm treating, right? Or both. Because they're meds that treat the emotional hunger better than the physical hunger, and vice versa. And that's where I see people on GLP-1 that are not successful, that have a lot of emotional hunger.
Yeah.
And they actually need a different medication that treats emotional hunger.
Yes.
So it has to be the right tool. You can just put, and for that reason, it's not like you are a non-responder. No, you're not on the right medicine.
Yes.
That's it.
Right.
So maybe, it wasn't prescribed with enough knowledge of your barriers.
Yeah.
Or maybe it was one tool for everybody.
Right. So somebody who is a good candidate for a GLP-1 agonist, if they do have excessive, let's just say, emotional hunger, they might also require a second medication, potentially.
Absolutely.
Okay. That's a really important point.
And a third medication. And the problem with that is that if you do a prioritization, the first question is this going to be used with another anti-obesity medication, right? But they never ask you that for high blood pressure. We use 2, 3, 4 medication for blood pressure, for diabetes, right? But God forbid you do it for obesity.
Right.
But I have seen amazing results in which you put a GLP-1 with some of the medications that control emotional hunger.
Yes.
And then you don't have to increase the dose of the GLP-1. You don't have the side effects. And now you're getting results. But you need control of both, right?
Totally.
So it might end up that one you pay out of pocket, the cheaper one, and the other one we put on the insurance. So it's like you need strategy with these things because it's not just the medicine. Then you have to have the availability to it.
Yes. Mm-hmm.
And I gotta tell you, the insurance companies are just getting super smart on how not to make these meds available.
Yeah.
So not only that the meds that were approved were difficult to approve, but now they're even pulling coverage back from that. So anyway, you need to be very creative to actually help your patients.
Yeah, absolutely. And like you said, another reason why you're not in a cabana on a beach sipping your tasty drink and just prescribing a pill.
Yeah.
It's so funny when you see in social media people who don't have any perspective on the healthcare system, who just think that, doctors are making all this money by prescribing medication. We're losing money by
It's ridiculous. It's ridiculous. The amount of time that we put into prioritization and appeals, and it's just, and we do it all for our patients.
Yeah, absolutely.
Yeah.
So absolutely. Yeah. Well, thank you for being here for our first podcast in a series of 3. Okay. So you all listen to me. This woman, this Dr. Pallin lady right here sitting next to me, who is incredible. She is absolutely incredible. And I just cannot recommend her more highly. She's going to be coming back in episode number 2. Okay. You're going to want to hear this because we're going to talk about, okay, great. Now you've seen your doctor, your obesity medicine doctor. You're on the medication. What do you expect now? What's going to happen? Are you going to drop, I don't know, you're going to drop 20 pounds in the first week? What's going to happen? All right. So you definitely are going to want to catch us next week where we come back and we talk about, okay, you're on the med. What's next? All right, my friends. So thank you so much for being here.
This was so much fun.
So much fun.
Thank you.
Thank you. We are going to link New Start Medical right in our show notes. And until next time, we'll talk to you soon. Take care now.
Bye.